alaikum. I am Dr. Anwar Shahzad. Today we will discuss another common topic seen in our society, that is jaundice. Jaundice means yellow coloration of skin, sclera, and tissues. So this is color by a pigment that is known as bilirubin. So bilirubin is the end product of hemoglobin metabolism. That is when RBCs are broken down. There is other this byproducts, that is biliverdin, and then it converted into bilirubin. And this bilirubin is toxic, and it has to be removed from the body through via the urine, via the feces. So when the bilirubin is more in amount, and it will give color to the skin, sclera, and tissues, then it is called jaundice. So jaundice is of three types. That is, it is related to the liver, and the causes could be prehepatic, hepatic, or post-hepatic. There is a cause with when this bilirubin is produced, and it goes to the liver, and here it was unconjugated, and the liver it becomes conjugated, and it becomes water soluble. Unconjugated is fat soluble but water insoluble, and conjugated is water soluble. So if it is to be removed, it should be water soluble. So there is a cause, that is, the bilirubin is being this conjugated, and again there is a jaundice, and there could be a cause in the canaliculi and this channels which take the bilirubin, the bile from the liver to the gut. So that may be due to the gallstones or narrowing of the canaliculi, or the pressure that is like, say, at a pancreas. So this, if we concentrate and investigate this jaundice, then we can come to know where it could be the cause. So if it is prehepatic, that is more RBCs are damaged, hemolysis is a main cause, just like malaria. Or there is a cause that if the bilirubin cannot be conjugated, or the hemolysis or the breakdown is the bilirubin production is much more, that it cannot be conjugated by the liver, and it is beyond its extent. So then again it will be, of course, perihepatic, and there may be damage to the liver cells, and when these cells are damaged, the enzymes are released, like AST and ALT, and this if these enzymes are raised, it means the liver is damaged, and it is hepatocellular. And again, of course, bilirubin will be an increase, and that is why the skin is yellow in color. And if this is the bilirubin is being conjugated, then even then there is jaundice. It means there is a obstruction, that this material, this juice, the bile juice, it is not coming out of the liver. There is a resistance or blockade of the canaliculi and this ducts, even common bile duct, due to stone at the pancreas. So this jaundice, as I said, it is a presentation of a disease, not the disease itself. So when there is jaundice, the relation is yellow. We will investigate by doing lab tests, and that is LFTs and ultrasound and other investigations, and even the clinical examination, abdominal examination, and general physical examination. Then we will come to know that where is the cause, and is it the cause is dangerous, or it can be moved or not. And of course, the treatment will be accordingly. And if there is hemorrhages, it can be further be prevented. And if the liver is damaged, we give it the supportive therapy, and we remove the cause which is damaging the liver. Although the even much more portion has to be damaged uh, to produce these symptoms. So the liver also says they can regenerate by the passage of time, but if the cause is prolonged and the cells are more damaged, they are replaced by fibrosis, and it leads to the cirrhosis of the liver and ascites and other complications. So this is the jaundice is the presentation of some disease. So we have to investigate and try to uh, rule out the cause and treat the cause. And the one more thing is the physiological jaundice of the newborn, jaundice of the newborn. That is again a jaundice. A baby is born, and after 24 hours, the color becomes mildly yellow. And the patient, the attendants, they say that the baby is jaundiced. So that jaundice is called as jaundice of the newborn, which is if it is after 24 hours, then it is called a physiological jaundice. That is due to the because the liver is if the liver is premature, it cannot clear the bilirubin being produced by the destruction of the hemoglobin, fetal cells, RBCs, and if it becomes if this bilirubin is unconjugated, that is fat soluble, not water soluble. The effect of this could be that this fat soluble or unconjugated bilirubin uh, will can cause the cardiac arrest because it can cross the blood-brain barrier of the newborn. So the when we give the phototherapy and other supportive measures, and if there is an infection, we can treat the infection as sepsis. And this is all about jaundice, which is a brief overview. We can go into detail, but this is a brief overview of the jaundice. And in next videos, we can discuss more in more detail. Thank you very much. Khuda Hafiz.